Oh, sorry, I didn't see you there. My name's Endometriosis Eddie. I'm part of Sigma Chi Beta Kappa. Today we're going to be talking about endometriosis. My good friend Abby got diagnosed with it, so we're going to go through her story and see what it's all about. Hope you're ready for the ride. Let's go.
Hey Abby.
Hi.
Are you okay?
No, I've had a terrible day. I'm having the worst cramps I've ever had in my entire life, and my back is killing me. And I feel like I could just throw up at any second right now.
Oh my goodness.
I'm on my period, and it's never been this bad, but it's bad.
How long has this been happening?
I don't know. Over the past few years, it's been getting worse.
Few years?
Yeah. Because I've noticed, I don't know, Fabio and I, it's our 3-year anniversary coming up, and we haven't been able to get pregnant yet, and so I started paying attention to it, and it's just been getting worse since we got married, and just since I don't know. I just don't know what to do.
I'm so sorry. You look like you're in excruciating pain.
Yeah.
But I really think you should go to the doctor, especially if this has been going on for 3 years.
Are you going to your doctor's appointment, Abby?
I am, Eddie.
Oh, I hope it goes okay.
Thank you.
Yeah, no problem.
Hey Abby, how was your
Hi.
doctor's appointment?
It was good, I think. I got diagnosed with something called endometriosis. Yeah.
Oh no.
Yeah. And I honestly don't remember a lot of what the doctor said, but he said something about my uterine tissue growing a little bit extra or something, and that's why I have really bad symptoms and like worse periods than normal, and it might be why Fabio and I can't get pregnant.
Doctors can speak very difficult language, and so I think we should try and find someone who can explain it in a more basic sense to get a better understanding of your diagnosis.
That'd be really good.
Let's Google experts.
Heyo, what's up? It's your boy Eddie. I'm here to describe to you guys what a normal uterus looks like and how normal menstruation occurs. And if you don't know what menstruation is, it's that time of the month that the ladies go through, So first, we got a couple parts to the uterus. Over here, this is one ovary, and then you have another ovary on the other side. And then up here, this is pointing to the uterus. So that is the triangle inside there. And then all the way over here are the fallopian tubes. So the fallopian tubes are where the egg travels down. So the egg comes from the ovary, and it travels down the fallopian tube into the uterus. And if it's fertilized, it'll attach to the uterine wall, but if not, it'll just be passed through during menstruation. And then down here is the cervix, which then leads into the vagina. So during normal menstruation, usually the uterine tissue is shedding from inside the uterus, like all in here, and it's shedding on the inside and then exiting down through the cervix into the vagina, and that's during normal menstruation. Alright, now that we got the basics out of the way, I'm going to throw it to the expert. Over to you, Ann. Thanks, Eddie.
Endometriosis, the uterine tissue, which is also called endometrial tissue, it grows outside of the uterus, so it's going to usually grow here on the fallopian tubes or in the ovaries, also in the pelvic peritoneum, which is the lining of the abdomen, or on the rectovaginal septum, which is the septum between the vagina and the anus. So as this endometrial-like tissue thickens, it breaks down and it bleeds just like true endometrial tissue. But unlike the true endometrial tissue, which leaves the body through the vagina, it's going to instead enter other parts of the body. Okay, so sometimes the endometrial cells are going to grow on the ovaries, and so that's going to cause cysts, which are also called endometriomas. So this abnormal endometrial cell growths cause irritation, scar tissue, and adhesions, which are abnormal fibrous tissue that causes the organs to stick to one another. The pathogenesis for endometriosis is not totally understood, so there's multiple theories and like multiple causes. The first one is called the retrograde menstruation theory, and so instead of leaving the body through the vagina, the endometrial tissue flows up through the fallopian tubes and into the pelvic cavity. Through the induction theory, the peritoneal cells, which are the cells that line the abdominal cavity, are transformed into endometrial-like cells. In the embryonic cell transformation theory, embryonic cells, which are like cells in their earliest stage of development, are transformed into endometrial-like cells during puberty. In the next theory, called the surgical scar implantation theory, after surgery in the abdomen, endometrial cells attach to the incision. In the next theory, endometrial cell transport theory, endometrial cells are transported to other parts of the body through blood vessels and through the lymphatic system. And the last theory, in like an immune system disorder theory, the body is unable to recognize and destroy abnormal growth of endometrial cells because the immune system is damaged.
All right, now we're gonna check back in with Abby and Chloe, but first gotta get some ball skills in, big game on Friday, you know.
Right, and you were telling me that the doctor said you were more prone to getting endometriosis because of certain risk factors.
Yeah. So I totally forgot about that. But he did say, let's see if I can remember it. He said, because I got my period when I was really young. I got when I was 8 years old.
Oh,
It was terrible, not fun. I was like the first one in my class. I think I'm scarred from it, but it's okay. So I got when I was really young, and they've always been really, really heavy, so that also kind of influences and like makes me at a higher risk for it. And then he even checked my estrogen levels and said that those were really high, which I've never looked into before.
Risk factors of endometriosis. Oh, ask endometriosis.eddie.com.
Click on that.
Let's do that one.
Yes.
Oh hey, it's Endometriosis Eddie from endometriosis.eddie.com. Bet you guys didn't know I did a little philanthropy on the side. So some other risk factors that Chloe and Abby did not mention are going through menopause at a later age, never giving birth, having a low body mass index, and then reproductive tract abnormalities. So those risk factors also put. Oh my gosh, it's my brother Kyle. I gotta go. We'll be back. So obviously endometriosis affects the lives of the people who are diagnosed with it. And so I'm gonna throw it over to my good friend Anne, and she's gonna help introduce and explain those topics. Over to you, Anne.
Thanks, Eddie! Endometriosis can have many effects on women. It can affect them emotionally because they will experience less of an intimate relationship with their partner, both because it's painful when having sex and because they struggle with infertility issues. Some psychosocial effects are that women with endometriosis have a high chance of mental health issues, like depression, anxiety, especially when trying to cope with all of the pain they feel.
Wow, this is all really depressing. Maybe we should go check in on our friend Abby.
Endometriosis can affect women financially too, and this is because it takes a while to diagnose and to treat. So there's repeated doctor visits and surgeries, and because it's a chronic problem, women have to deal with it financially their whole lives. It can affect women spiritually, either positively spiritually or negatively. they can experience feelings of why me, why do I have to deal with this, and it can make them question a higher being, or they can turn towards religion in order to cope with their struggle. Overall, endometriosis takes a toll on women in all aspects of their health and of their life.
Abby! Oh my gosh!
Okay, oh my gosh, it's so good to see you.
Yeah.
So as an update, I had a son.
With Fabio?
Yes.
Oh my
we have a little
gosh.
mini Fabio running around. He's
What's
a
his
year old.
name?
His name is Charles.
I love that name.
Yes, he's a cutie. But yeah, so last time we left off, I had just gone to the doctor. I haven't seen him.
Yeah, what happened? Did you get treated
Yeah.
for endometriosis?
Yes. So it was kind of a long-ish road. I had to go to a few different doctors.
Okay.
And yeah, my pain was so bad, you knew that.
Right.
And so they put me on just a pain medication, just some over-the-counter stuff to manage my pain while I was going to the different doctors.
Mm-hmm.
And then I ended up going to this one doctor who performed a laparoscopy.
Okay, so you
Yeah.
just looked around,
Mhm, just kind of-
explored.
Yes,
Got
exactly. And they found out that I wasn't releasing an egg every month, which was a huge part of the issues that I was having. And so then I went in a little bit later, and they went in for a complete surgery, and they took out some of my lining of my uterus, and then they took out a tumor that was there.
Oh my
Yeah.
goodness.
And so, but after that, they put me on hormone therapy because I told them that I was really wanting to have a kid.
Mm-hmm.
And so I was on hormone therapy, and for about like 4 months. So 4 months post recovery, I got pregnant. And then yeah, I had little Charles. And yeah, it's been good ever since. My cramping's not as bad, my pain's not as bad. It's just been really good.
Oh no, oh gosh. Hey guys, I hope you had just a baller time with us learning about endometriosis.